Hi, and welcome to another program of Breaking Ground, where we talk about the new and innovative projects that are happening in Lincoln, Nebraska around the topic of healthcare. And today I'm happy to welcome Joan Anderson, the director of the Lancaster County Medical Society, to talk about a project that's not necessarily new to Lincoln. It's not something that has just recently started, but it's something that has made some great strides and evolution here in recent times that we need to be talking about because it has great implications for many people in our community. And so that's what we're here to talk about, and it's called Health 360. So Joan, I want you just to tell me how maybe it got started and
Sure.
what we're going to be talking about today.
Well, you're right, it's not new. Actually, Health 360, as it's known now, was originally called Medication Assistance Program. We started in 2003 to help people that had no insurance basically get their medications free or at discounted rates. Well, over the last 10 years, and this is our 10-year anniversary, it has had many evolutions. And instead of going through all of those with you, because it really is somewhat difficult to explain in a short period of time, what we've produced is a short little DVD that I would like to share with the audience today. And that DVD will show you, I think, not only the growth of the program and how many people it's impacted, but I'd really like the viewers also to look at who's talking on the DVD. And I think it will show a number of themes. Number one, we're helping a lot of people, making a great deal of difference in their lives. And number two, it really emphasizes the adage of it takes a village. We have many, many partners. Many of them are featured on the DVD and many of them aren't, but we can talk about that after the viewers have a better sense. So I think I would like to show the DVD and then go from there and maybe answer some questions.
I agree. I've had a chance to see the video, and I think it does show that there is a huge spectrum of people that are working toward addressing a really tough problem in our community. And what this video also does is it takes us kind of through how this program has evolved and how we've gotten to this point. Right. So let's go ahead and watch the video about Health 360.
The number of individuals in the United States without health insurance has been a growing concern for many years, even though there is a national movement to address this rising epidemic. Until that happens, each community must find their own solution. Lincoln has a long history of helping those in need.
The mission of the Health Department is to protect and promote the public's health, and that includes providing services for those individuals that don't have access to care or don't have insurance. So in the mid-70s, the Health Department started a program for a free clinic for individuals who didn't have health insurance, and we used volunteer physicians to provide that service.
The Health Department's free clinic, staffed by volunteer physicians, served thousands of uninsured clients each year. However, offering free care did not address the concern that clients could not afford their prescription medications. In 2003, the Medication Assistance Program was created. Funded by a grant from the Community Health Endowment, the Health Department and the Lancaster County Medical Society developed a program to enroll patients into free national patient assistance programs, first at the Health Department and then citywide, saving patients thousands and thousands of dollars each year.
Lincoln's been blessed to have many physicians who are willing to give their time to the community and give the time to these patients who have limited resources. Hospitals were also wonderful about volunteering a lot of services, but the main piece that was missing was the medication, one of the most important things that we can do as physicians. So this Medication Assistance Program provided a tremendous resource for these patients who couldn't afford their medications.
Based on the success of this program, the Lancaster County Commissioners asked for assistance.
Lancaster County is responsible under state statute to provide for those in our community who have no other means of support. So we provide rental assistance, medication assistance, anything else that they might need. And as county commissioners, we have faced budgetary difficulties for many years. And in 2004, we had the opportunity to partner with Lancaster County Medical Society with the Medication Assistance Program. And at that time, we were spending approximately $125,000 per month in pharmaceutical costs. And in partnering with them, we've been able to reduce that down to about $25,000 a month. So we have been able to save the taxpayer approximately $1 million a year, and at the same time to provide support to more people more efficiently.
The Health Department continued the lead role to serve the uninsured as they work to expand the capacity for health care in our community.
In 2002, the health department brought together a coalition of folks to look at resources that would be available to form a federally qualified health center. And in 2003, then People's Health Center opened as Lincoln's first federally qualified health center.
The establishment of People's Health Center increased the capacity for the uninsured to receive care. And with that, there was an increased need for specialty services. A second grant from the Community Health Endowment began Health 360 Specialty Care, which meant these services were available on a sliding scale.
As an anesthesiologist, there's nothing worse than having to see a patient come in for an emergency case when it's something that they could have done as an elective procedure. And Health 360 allows them to take care of things more as an elective instead of having to go through the horrible situation of being in an emergency room.
Through this program, people who might not otherwise have access to care are able to seek medical attention. Through this program, they may achieve an earlier diagnosis for some of their medical problems that might otherwise go undiagnosed. In the long term, this may prevent complications of such disorders as hypertension, diabetes, and in some cases even get an earlier diagnosis of cancer. So this program may be life-saving for some people in the community.
The number of uninsured continued to grow to the point People's Health Center was unable to meet the increased need. Once again, with a grant from the Community Health Endowment, the Medical Society expanded their program to include accessing a medical home.
El Centro de las Americas is really appreciative of the Health 360 project. Our clients always demand prompt appointments at the time when they need to be scheduled. They only come when they need immediate assistance. So having this project at hand to be able to refer them to has been great. Especially right now, I have in mind a client that recently moved from Texas, and she was very ill. We got her right away. Within a week, she was seeing a doctor, and it's all thanks to Health 360. They even helped her out apply for Medicaid.
Each year, the program, now known as Health 360 Project Access, assists over 2,000 clients with free medications. Approximately 1,000 individuals access specialty care services, and an estimated 40 patients each month establish a medical home with a doctor. Health 360 has been able to expand services over the past 10 years primarily due to 4 major funders: Bryan Health, Community Health Endowment, Lancaster County Medical Alliance, and St. Elizabeth Regional Medical Center. These funders realize the impact of the program on the patients we serve.
Well, the vision of the Community Health Endowment is to make Lincoln the healthiest community in the country. And a big part of that would be if people had access to the health care and the medications they needed to stay healthy. And that's exactly what Health 360 does, is provide those medications and that health care to folks who otherwise wouldn't have access to it. And if you've ever had a chance to sit down and talk to one of the folks who have benefited from this program like I have, I can tell you that it has not only changed their health, but it's changed their lives.
I was missing so much work, but I couldn't afford to go to the doctor. I ended up in the emergency department, and they told me about the program. It was such a relief. Now I'm finally back at work.
Our son lost his insurance and his medications cost over $400 a month, so he stopped taking them. Our doctor told us about the Medical Society. We are so thankful he is better, has a part-time job, and plans to go back to school.
Our pediatrician told us about Health 360. We could not believe it and are so grateful. Our little girl was able to get the surgery and miss only one day of school. What a blessing.
I had insurance my entire adult life until I lost my job. Then I was diagnosed with cancer. I was devastated until I was told about the Medical Society's program. I am a firm believer Health 360 literally saved my life.
Health 360 Project Access is a program of the Lancaster County Medical Society. For more information, call 402-483-4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800. 4800
Well, Joan, I think that was a great introduction to Health 360, a great overview of how the program started,
Right.
all the people it's impacted, not only government, local government, but the patients and the providers, the health department, just a whole spectrum. And if you look at a project like this, you can see that for those who don't know about it, it even affects them. It affects
Right.
those out in the community who may not be even aware that something like this is happening.
Right.
So tell me how this has all come together in this way. I mean,
Okay.
tell me what has been the biggest challenges and biggest successes with making this all work.
Well, that's a tough question because it has happened over the last 10 years. I think the reason it works as well as it does is because of all the partners. Number one, all of our physicians in the community, 600 plus, are involved, which means that they work with us getting their uninsured patients, their medications, which I don't want to take a lot of time, but that's not an easy thing because they have to fill out a lot of paperwork, but they're all willing to do that. And it did not happen overnight, but over the last 10 years, the medication has been a pretty standard piece of it. Through the Community Health Endowment, as the program showed, we've gotten several grants. The one in 2007 was huge to many people because that meant they could get specialty care. We have
Describe specialty
Sure.
care.
We have anytime, some people can afford to, don't have insurance, but can afford to go to People's Health Center or maybe even afford to go to their primary care. They're working on cash discounts, but now they have a gallbladder they need out or a hernia repaired or orthopedics, that's always a biggie. I need a knee scope or I've broken my leg. I mean, just anything other than your day-to-day routine. Obviously, I'm not sure any of us, even those of us with insurance, could afford to pay for a full price of that kind of specialty care. So again, all of our physicians, as well as the anesthesiologist, and a key component is the hospitals. The hospitals provide financial assistance so that very rarely do people have to pay anything. If they do, it's a very discounted rate. And then our patients pay at a very discounted rate the anesthesiologist and surgeon or specialist, whoever it might be. How we do that is we do it on a sliding fee and we do it on urgency. And sometimes that can be a little hard to explain, but it is kind of case by case. We will get someone into a doctor immediately, and for example, just this week, we had someone who does need a hernia, but the surgeon said, he's fine, he can work, it's not a hurry, but certainly something we want to take care of in the next year, for sure. And so the patient knows what they have to pay, and they are building up their little reserve so they can pay that, and we anticipate we'll probably schedule that surgery in about 3 months.
And I think it's fair to say that this is a hands-on program. I mean,
Right.
it's not that people don't have interaction at a pretty significant level with you, your
Right.
office, with lots of folks. It's
Right.
not a process you go through without human contact.
Exactly,
Yeah.
exactly.
Which
Yeah.
I think is one of the reasons why it's been successful,
Right.
is you really understand the needs, and not only for that patient, but what you might expect down the road
Right.
from other patients.
Right. And we also quickly assess if there are other avenues, if they might qualify for general assistance or if they might qualify for Medicaid. So we never just assume they have to go right into our specialty care program. If we can get them into a governmental assistance program, we will do that. Many of them can't because they're working and they can afford payments. They just can't pay a $10,000 surgery. So that's the specialty care. And then just this year in July, well, I guess of 2012, we started the medical home component, again funded by Community Health Endowment, where we're finding that many people in the community have been with a primary care provider for years and now they've lost their insurance or they've lost their job or a combination of things. They really don't want to switch and go to, say, People's Health Center that could be on a sliding fee. Those referrals are coming to us from our doctors. They'll call us and say, we've got a patient we've had for 10 years, she's a diabetic, or maybe she only needs to come in once a year for a thyroid check, but she can or he can no longer afford it. And then we put them on a sliding fee for the medical home.
And so the physicians are not asking to be paid in full.
No.
They're not asking for full insurance rates, but there is a stipend involved,
Right.
and that's
Right.
where CHE has been able to
Right.
provide some assistance and others. And like you saw in the video, I mean, there has been the Lancaster County Medical Alliance, the two hospitals, both Bryan Health and St. Elizabeth Regional Medical Center, and CHE have partnered
Right.
on this project. And it's, like
As
I
well
said,
as many private
and
donors.
Right, exactly, many private donors.
Right.
So tell us, I mean, I'm sure there are people watching who are saying, how do I figure
Okay.
out if this works for me?
Sure.
And so how do they do that?
Okay. It's really as simple as call us, because we're going to have to, everything is case by case by case. The one thing I'd really like to emphasize, even if I gave the example of the one that wasn't an urgent hernia, we've had, for example, about 3 weeks ago, we had a gentleman that was referred to us by People's Health Center, and he'd been in the emergency department 3 times. He needed his gallbladder out, or he was not able to continue working. We got him into the doctor. The surgeon said he needs this sooner rather than later. And he didn't have the money to pay up front, even at the discounted rate. So in those cases, it's all about, as you said, communication. The physician clearly said, we've got to do this. We told the patient, this, based on your income, this is what you will pay. He was able to pay $50 to start. That's been about 3 weeks ago. He will be back at work soon, and I fully believe that he'll start making payments toward that.
And what you have told me at other times is that people are willing to provide some level of payment for the service they're receiving.
Absolutely.
It just may not be that they're in a position to pay what we know sometimes are the higher rates or the higher reimbursements that are provided. And so this is a program about providing what you can to get a really needed service.
Exactly.
And so I think it does take a village
It does.
to make this happen.
Absolutely.
And in this case, this is a perfect example of where a program started and then slowly has evolved to not only continue doing the medication assistance, but adding on other kinds of services as they've been determined to be needed in our community. And people have come alongside that and made it happen. And as you mentioned, lots of people.
Lots of people. And I will just say, as far as accessing the program, we're getting more and more what I guess you'd call friends referrals. In other words, someone will call and say, well, you helped so-and-so about a year ago, and I've got this or that, and that is great. We get many referrals from our physicians. We get many referrals from churches, from human service agencies. The word is out, except like most programs, you don't even think about it, or your radar isn't there until you do need it.
Yeah.
So I'd really encourage everybody to just write down the number. If they know of someone,
tell the number.
Is 402-483-4800.
And they'll get the Lancaster County Medical Society. Okay.
And we will, everyone that answers the phone, we're a very small organization. We all know the routine. We'll decide, okay, you need to go to maybe the health hub to get help with general assistance, or we need to get you into a medical home right away, and we can get appointments within 24 to 48 hours. We even have urgent care appointments. I should say that. Since we started
and
the
urgent
newest
care meaning
Link Cares, any of our urgent cares, if someone calls in and says, and this has happened frequently since we started this program, I think I have pink eye, my kids had pink eye, they're on Medicaid, but where do I go? I think I have strep throat, again, maybe their children, those kind of things.
Urgent issues are more emergency, but not emergency room level kinds of things.
Exactly.
Yeah.
Sinus infection's been a good one this year. So it really has, we can take everyone case by case by case, and I think the thing that makes it easier for us, and we feel like we really are meeting everyone's needs, is that close working relationship with the physician, and the physician will say, we got to do it. Whether they can pay for it or not, we've got to do it. Or, this can wait. It's not an emergency. It's not even urgent. It's something they need down the road, but maybe we can manage it with whatever before. So it's really important.
What it does is provide access, and
Absolutely.
that's a critical point to any person, family, individual that needs care. So,
and I would also say, well, you know, we could go on for hours, but we get calls from Lincoln Public Schools for children that either are new to town, they haven't gotten approved for Medicaid yet. Frequently we get calls from Lincoln Public School nurses that say we need help with a medication. Maybe they have insurance but they can't afford the medication. So it's not just for adults. Generally it is for adults because most of our kids we can get on Medicaid, but they may not be on Medicaid immediately, and they may need that.
Or that paperwork time.
We've had situations where kids are visiting from outstate, visiting grandparents here. They may be on Missouri Medicaid or Iowa Medicaid, and now they've got strep throat. Well, Medicaid won't pay outstate generally, and so we can work with those. So there's so many scenarios that we can find an answer. We will find some place and somehow to help them. But as you said, it is on a sliding fee. It's not free. That being said, we work very closely with the free clinics because the free clinics do make referrals to us. They may see them initially and then they give them to us to get them into specialty care or a medical home.
Well, I think one of the things in our community that we talk a lot about is the safety net, and that is where folks go to get care when there isn't any other options. And Health 360 is a perfect example of a safety net. It's the place where people can literally fall when there's nothing else there to help them. And so it's been my pleasure to talk about Health 360 today, to talk about how it started, all the people that have helped it continue to grow and prosper, and how it's continuing to serve our community even today, and I anticipate very much into the future. So thank you, Joan, for being here today. And thank you for joining us again on Breaking Ground. We look forward to seeing you the next time.